So I'll see the patient. I text them that evening. So really the whole procedure, like I've said, is so painless that people go skipping out of here. And I warn them, you're gonna need to like go home, ice, and take some pain medication before the numbing wears off. So do not, make a run to Costco, don't do a load of laundry, all these things that people have done because they're like, that was so easy. And no big deal. I'm like, no, because the local is going to wear off at some point. So I want people to be settled when it does actually wear off, because that first 24 hours is kind of where you're going to have some pain and discomfort. And then after that, it's mostly just swelling. Once the numbing pain wears off, it's definitely uncomfortable. I used to prescribe oxycodone only and tell patients they could take Tylenol or Motrin with that. I have started prescribing something called Journavx. It's a new non-opioid alternative, which is great. So you take two of those, 250 milligram tablets in the morning, and then one that evening when you get home. And for some patients, because I have some patients who are super motivated not to use narcotics at all, that's all they need. They can take that and Tylenol. Most patients, since we've just started doing this, are taking one or two oxycodone that first 24 hours. So before I had the Journavx, I would tell people to go home, take the oxy, and then if you need another one, you need another one. But at least have it on board before the numbing wears off. And I mean, most patients, again, probably use 3 or 4 oxycodone in that first 24 hours max, and a lot less with a Journavx. Again, it's a little painful the first 24 hours. And then after that, it's really just uncomfortable because you're swollen. So it's, pain medicine is not necessarily going to help you, but icing will. If you've had kids, then most of those patients are pretty adept at dealing with this. I would say, though, the majority of my patients have not had children and are in their 20s. Some of them are 30s and haven't had kids. So it's funny, some of the best tips I've gotten for post-op regimens have come from women who had kids. And Bree and I we have 5 kids between the two of us, are absolutely useless for this because we had sections. So we've had 5 C-sections and we don't know jack about all the stuff that they do once you've delivered vaginally. We're like, wait, what? We didn't get any of that. So we give patients an action like little baggie with them. And so like Dermaplast spray is one of the things we give them. So I personally haven't used the Dermaplast spray, but one of our patients suggested it afterwards and said, hey, I use this after having my kids. Can I use it now? And I said, yeah, that sounds great. And then we asked her more about it post-operatively. And we're like, we're just going to include this in your little baggie, your to-go baggie. So that's been one of them. They make these like kind of period panties or like post-maternity panties. They're like that have pads in them, and also an ice pack can slide in there. Did not know about that postpartum. Yeah, so now we give everybody one of those, put an ice pack, it slides an ice pack, they can slide in and out, and you wear these kind of disposable panties. And then, they also get some arnica, a little bit of Aquaphor to put on the incisions. That's kind of the basic kit, and some pads. But yeah, I mean, we had started with just like, "Here's the ice pack in your underwear," and go home. And then we had to be more specific because people showed up without underwear, with a thong. I was like, no, 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 no. Yeah, a thong. Like, where am I going to put the ice pack in? So anyway, so now we're like, here's your underwear. Here's these like maternity panties you can put on, and that has an ice pack that slides in there. So it sets them up for success. Oh, and then we also give a peri bottle. That's another like postpartum thing. So the little squish bottle that you can fill with warm soap and water and like spray off the area after you go to the bathroom, because you don't want to be wiping too vigorously down there after the surgery. Like I said, we're always looking for anything else that complements that post-recovery care kit besides, endless episodes of Love Island. But it's really just feedback from our patients on, what makes something a little bit more tolerable. So I do my repair with absorbable sutures. There's 2 layers of suture that you can't see, that are kind of what we call subcuticular, but under the skin, and then one layer, outer layer that you can see, but that is going to dissolve usually in the first 7 to 10 days. So I see my patients back on day 7, and sometimes there's a little residual suture that I can see, and sometimes it's already broken down by then. And then I see my patients back at 1 month. You could say 4 to 6 weeks, but I feel like if I see you at 1 month and you're healed, then you can go back to living your best life. So I'd rather see you earlier. And then if there is like a little bit of swelling, then I'll see you back at 3 months. But if I make you wait until 6 weeks, then you're going to be bothering me at like 3.5, 4.5 weeks. Like, can I do this? Can I do this? So I think it's easier to see people on the earlier side because most people are completely healed. So they can go back in the water, hot tub, intercourse, tampons. Inevitably, you're going to get your period while you have the surgery. Like, it's a bummer, but unless you can plan it, which again, most people are not on oral contraceptives anymore on the actual pill. They have either the implantable device or an IUD because that circled back around. So people don't take oral contraceptives as the actual pill as frequently as they used to. So you don't really control your period. We tell people, if you get your period, it doesn't, like if we had to work around everyone's menstrual cycle, we would never get anything done. So it's fine. I do see a lot of patients from LA. So I tell them I can virtually see them at a week because you're going to go home. I definitely recommend they have a driver, like come with a driver, even if they do it under local, because that way they can lay in the back seat on the drive home. And then, so I virtually check in with them at a week, and then I will see them back at 1 month because that's when I really want to give them the thumbs up. Like I've laid eyes on them and they can go back to doing what they're doing. But sometimes, like I said, when people are traveling from out of state and they're staying with someone because I don't necessarily want them to get on a plane. They'll stay for like a week and I'll see them at 1 week and then the month will be a virtual. And I do it through HIPAA compliant video chat. So if I have to look at something, I can. But it's usually just touching base. So the risks of labiaplasty are probably over resection and then leaving people with scar tissue in places that might be uncomfortable, like the posterior aspect. Um, I think scar tissue and tethering and the complications I've seen either presented or in papers have been related to over resection. So it's real important. I always tell patients I can always take a tiny little bit more, which I don't often have to do, but it's better to have a little bit more labia than have like a weird scar or pain afterwards. The other complications are bleeding or infection, and those are very rare. You can have a bleeding complication like a hematoma. Again, it's usually about taking it easy for those first 3 days. And then if it's an immediate bleeding problem, then I would bring you back to the operating room and explore and reclose. I've had to do that once, knock on wood. So it's not very common. And then wound healing complications, also very rare. So it is more prevalent in smokers. So I do make sure that you're not smoking for 2 weeks before and for 2 weeks after. And we do a nicotine test on the day of surgery, and I'll cancel you if you're positive for that, because the one time I had like a real wound healing issue was in somebody that was smoking and I didn't recognize that. So it's funny, again, I'm in Southern California, so marijuana is legal. Um, I don't really care about the marijuana. It doesn't have wound healing problems. I prefer if people are having general anesthetic that you're not smoking marijuana and you switch to edibles. But if you're, you know, doing marijuana and having a labiaplasty, it's not really my problem. But I will say any kind of smoking, nicotine gum, vaping, regular good old cigarettes, all of that's any kind of nicotine is impairs wound healing. And so we make sure that that's not on board. And then, making sure that you're careful after surgery is important. I cannot stress enough how important it is to give yourself time to recover. That definitely decreases your risk of having complications. So people do it all the time, like, are, you know, pushing the limits, but I really think you're taking a risk that you don't want to have to take. I mean, I get so many questions from my patients that they'll text me like, "Can I X?" And I'm like, "No," afterward. And they always say, "Yeah, I thought you would say that." I'm like, "I know, but it's fine if you wanna ask." Like surfing, paragliding, rappelling. People get really adventurous right after they have surgery. So those are all no. Travel, I had one patient travel to Spain post-op day 3. I wanted to kill her, but, she did okay, but just because you can get away with it doesn't mean that you should. So she had found like a really good ticket because people take time off for, recovery and then they get, now I could go travel somewhere. No, no, please don't, because you're gonna have to sit somewhere for hours upright. And so it is just gonna lead to increased swelling and can increase your complication rate. And I did have one patient go to prison the next day, but she also did really well despite that. And we only knew because we got like a um, fax that came through from the sheriff's office, like this person's in detention and we need to know if there's any medical restrictions because she mentioned she had had surgery. It's like, and I was like, "Yeah, is there a way you can accommodate her and let her lay flat? Like, what? You're in jail." Anyway, that's the most outlandish one. But most of the time people just ask and I say no, and then we're done. So the first few days, you're very swollen. The first week to 10 days, you're swollen. You feel uncomfortable when you're walking around. You're going to want to wear loose fitting pants, but you can go back to doing your things like running errands, going to work. The people who have it easiest are the work from home people because they can like sort of adjust their sitting and standing and all of that during the workday. And then if you do a job that requires heavy lifting, then I would say you need to take a week off so that you're not doing that. It's 2 weeks and not getting your heart rate or blood pressure up. So in Southern California, the hardest thing is telling people they can't really work out for 2 weeks. And they get super uptight about that. But I don't want you doing anything for 2 weeks. So, and then after that, you can increase your activity level, but just at a pace that you can manage. So I've done athletes and I tell them, you can go back to working out after 2 weeks, but maybe don't do the team training because you need to be able to regulate, oh, it's too much, it's not enough. And then most patients turn a corner at 2 to 3 weeks and they find like, oh, unless I've had a really long day, I don't even remember that I had surgery. And by 4 weeks, you're feeling pretty healed. And it's different for everybody. Some of it has to do with the amount of tissue that we're removing. Some of it has to do with whether or not we're doing clitoral hood balancing. So removing the tissue from the upper third area, that usually leads to more swelling. Sometimes patients just have labiaplasty on one side. So one side's really long, the other side's pretty short or normal. And those patients will heal faster than someone who has, a lot of tissue that we're removing.